Hello, welcome back to Health Talk with Dr. Toyin. Today we'll be discussing middle ear infections, or medically speaking, otitis media. To better understand this, you'll need to look at a diagram of the ear. The ear consists of three parts. The first part is the outer ear, which extends from the pinna, which is the part that is visible to everybody at the side of the head, extends to the eardrum. The middle ear has the eardrum and the three bones of the ear, which are the malleus, incus, and stapes. The inner ear consists of the cochlea, which is responsible for balance. Middle ear infections have a peak incidence between the ages of 3 to 6 years, but it can occur in any age group. It is more severe in premature children and those with organ problems like heart, liver, kidney. How does it manifest? Well, the commonest symptom is ear pain. And if you've had an ear infection before, you know it is very painful. Another thing is discharge. What happens is fluid tends to build up behind the eardrum, and the eardrum now bursts, releasing the fluid, which you now see as ear discharge. Most of the time, when the eardrum bursts, the pain actually goes down. In smaller children, you'll notice some ear tugging, and in very severe, like I said earlier, you might have fever or cough. Now, in 80% of children, this can resolve within 3 days. So I would suggest giving at least 3 days before seeking medical advice. But if during this time you notice increasing fever or increase of symptoms like cough, or if there's an ear discharge, then it's advisable to see your health professional before 3 days. Now, how can otitis media be treated? First line, what you need to do is to take analgesia like paracetamol and ibuprofen. I would suggest for the first 3 days you can take this regularly to help deal with the pain. Antibiotics are indicated in a few cases. In children less than 3 years, especially if they have middle ear infection affecting both ears, they might need to take some antibiotics. For those that have organ problems like heart, kidney, or liver, I would suggest going to see your medical practitioner even before the 3 days, because most likely you will need antibiotics. In very severe cases, when you get recurrent infections, you might need to have what is called a grommet inserted to try and help deal with the recurrent problems. Now, in cases where the eardrum has burst, it can still heal back, and it might take up to 3 months to do this. And during this time, you might notice a slight reduction in your hearing capacity, and that is just because the eardrum is not healed well enough to deal with sound coming into the ear. I hope you enjoyed this session, and don't forget to subscribe to my YouTube channel. Hit the like button. Next month, which is the month of love, we'll have topics relating to reproductive health. I would like to hear your suggestions, your comments, so please keep them coming in. And until next time, remember to smile because it's healthy. Bye.